want to encourage you to see your children's dentist on the next checkup and ask them a few questions. That will help you determine if there is bigger problem. I want the dentist to be able to check for the lip seal, for the correct oral posture, for the changes in their posture. So they should check the neck and shoulders. Postural problems will affect the jaw. So they will be able to see early signs. Also, they will check for long face features. They will see if there are circles, dark circles around the eyes and puffed up eyes. And internally, they will be able to see if the teeth are already crooked or if there is indication that they are actually not growing the way how they should. If the palate is high and narrow. So I want you to remember that roof of the mouth is the floor of the nose. So if structurally the palate is too high, it will dig into the nose and will affect the breathing. So, I strongly believe that you can avoid braces if your breathing is restored. And dentists often have different appliances you can use before for the early intervention, which are much cheaper and effective when the child is still growing. So I strongly encourage you to ask your dentist those questions. My name is Diana Marshall from Breathing Rehabilitation. I'm based in Sydney, Australia, but I work online and you can find me on breathingrehabilitation.com if you have any questions or you need further support. For free resources, you can always go to my social media, Facebook, Instagram, and see all those information I post there about breathing. You can also subscribe to my YouTube channel, any videos on breathing and how to breathe functionally, what to look for, and how to improve our overall health. Thank you so much for being here, and I see you next time. Bye bye.